Well, after 2 years of certainly a rocky ride with the pandemic, parents and students are preparing for the return to classrooms. Definitely with some uncertainties, though, about how that's all going to go.
So to answer some of your viewer questions, we're joined live now by Dr. Dina Kulik, pediatrician and founder of Kids Crew. Dr. Kulik, good morning to you. Thanks for joining us. So we have some viewer questions we want to get to. Our first viewer, Keem, wants to know, are we expecting cases to rise when schools open?
Unfortunately, yes. As we see people together, mostly probably without masks in an enclosed setting, viruses do typically spread in those settings, and Omicron is likely to spread during that time.
So Keem also has a follow-up, Dr. Kulik, then asking, said, should we be concerned about potential long-term effects of the vaccine of COVID, not specifically asking about COVID itself, but the vaccine on our children?
There hasn't been any conclusive evidence or any research evidence or even real world evidence that the vaccine causes any kind of long-term side effects whatsoever. However, there is lots of evidence that long COVID exists, and that many kids, unfortunately, and adults do have symptoms long-term of COVID infection. The vaccine does not cause long-term issues.
Okay, and Dr. Kulik, with the current children's liquid acetaminophen and ibuprofen shortage, what do we do when kids develop high fevers and we can't find the over-the-counter medications needed to lower that fever? That's from Angela.
Luckily, many pharmacies do have stock of acetaminophen and ibuprofen products. So if you don't find the stock in one pharmacy, I do encourage you to check out another. You can look online as well. Many online pharmacies do have stock. If your child is older and can take a chewable medication, that's another option. Or if they're even older than that, like some of my own children, my 7-year-old and 2 older children than that, they can swallow pills now. So if the weight is such that they're at least 20 kilos, they can actually take a chewable or a adult version of an ibuprofen or acetaminophen product. I always recommend, though, to double check with your healthcare provider, double check your child's weight, any health conditions they may have, and find out the best dose for them based on their size and weight.
Yeah, that certainly makes sense indeed, Doctor. Doreen has a question. This is sort of outside the realm of COVID. This is a classic when it comes to, kids in school. She's asking, are there any new treatments for head lice?
It's a great question. Unfortunately, head lice is still treated with pesticide kind of medication that it has been since I was a young child. Some of the medications have become less effective over time. Lice has become resistant to certain ones, but there are some great products on the market that do a good job of killing off the lice and the nits as well. Another great question for a pharmacist if your child is affected, because there are newer generation pesticides that do a much better job than the ones that were available when I was growing up.
Okay, and Dr. Kulik, next question comes from Cynthia, who asks, my daughter is immune compromised due to infusion medication. She's going into the 6th grade. School has been online for 2.5 years now and is going to be back in person. Will her mask protect her when everyone else is not masking?
Ideally, everyone is masking. I know that's not realistic for many families and many schools nowadays, though I do strongly recommend wearing a mask, both for a child who has any risk factors like this child, as well as for everybody. Not only does masking prevent COVID illness, but also prevents many other viruses that do spread quite rapidly, sometimes in the fall and the winter. So when possible, I do encourage people to wear masks. If not everyone is masked, as long as you're masked, you are doing some good in preventing yourself from getting sick, but also passing on illness as well. It's better if more people are masked, but as long as the wearer is wearing a mask, there is some element of protection there.
Okay, of course, another element of protection, of course, is the vaccine, Dr. Kulik. And, since the vaccine's been rolled out, even to the youngest cohorts, even all the way up to sort of age 12, the uptake hasn't necessarily been that significant. So 2 things. One, what have we seen in terms of, vaccines, any issues at all from that? Because some people, I think, are very cautious or maybe overcautious, potentially, depending on the thoughts, about putting it into young children. And then secondly, the whole idea of, going back to school, going back to classes, without the masks on, et cetera. If you're thinking about taking a vaccination, what's the timeline now? Because school is just, of course, a couple of weeks away.
The vaccines are found to be very effective and very safe They've been given to millions and millions of children around the world now. They do not cause significant short-term side effects or any long-term side effects at all that we're aware of. They do certainly prevent severe illness and death from COVID, and to some degree also prevent COVID illness as well as passing it on to other people. So I do recommend the vaccine. So do many other big bodies, the World Health Organization, the CDC, the Canadian Pediatric Society, and others. They really don't have significant side effects and can minimize the burden of illness. And otherwise, it's really a matter of wearing masks when you can, keeping your distance when you can. Please stay home if you're sick. I think we've kind of moved in this other direction of illness is no big deal. It's just a cold. It's just a virus, which is why a lot of people feel that their children don't need to be vaccinated because it typically is a mild illness for children. That being said, there are kids out there that do get very sick with it, do get hospitalized with it. And of course, kids that are at higher risk than potentially your own children, those vulnerable kids, immunocompromised kids that we want to keep safe as well.
Yeah, that's an important reminder. All right, Dr. Dina Kulik, pediatrician and founder of Kid Crew, appreciate your tips and thanks for answering all our viewer questions this morning.